Welcome, everyone. This is Rebecca Salon. I'm the project director for the LEAD Center, and I'd like to welcome you to our webinar on the ABLE Act, a tool for financial stability and employment outcomes. We're very excited about today's webinar. Before I turn this over to Michael Morris to present and moderate the webinar, I wanted to provide you with some information so that you can all fully participate. If you don't have sound capabilities on your computer or prefer to listen by phone, we've provided you with phone numbers that you can call in. You don't need to enter an attendee ID number. Real-time captioning is provided during this webinar. Captions can be found in the Media Viewer panel, which appears in the lower right-hand corner of the webinar platform. If you want to make the Media Viewer panel larger, you can minimize the other panels like chat, Q&A, and/or participants. For the question and answer portion of the webinar, please use the Q&A box to submit any questions you have during the webinar, and we'll direct the questions accordingly during the Q&A portion of the webinar. We encourage you to submit questions. If you're listening by phone and not logged into the webinar, you may also ask questions by emailing questions to the host, Aramide Owushika at aawshika@ndi-inc.org. Please note that the webinar is being recorded and the materials will be placed on the LEAD Center website at the link provided. If you experience any technical difficulties during the webinar, please also use the chat box to send a message to the host, Aramide, at email address aawshika@ndi-inc.org. And now I'd like to turn this over to Michael Morris, the Executive Director of the National Disability Institute, LEAD Center's Policy Co-Chair. Michael?
Thank you, Rebecca, and thank all of you for joining us today. This webinar clearly touched some nerves and interest and curiosity from so many people across the country. The registration has reached almost 1,300 people nationwide, from all people joining from all 50 states. That is the largest total ever for one of the many webinars that the LEAD Center has conducted over the past 4+ years. For those of you who are not familiar with the next with the LEAD Center, the LEAD Center is the National Center on Leadership for the Employment and Economic Advancement of People with Disabilities. It's a collaborative of disability, workforce, and economic empowerment organizations led by the National Disability Institute with funding from the U.S. Department of Labor's Office of Disability Employment Policy. To learn more about the LEAD Center, I hope if you've never visited our website, you will at www.leadcenter.org. The LEAD Center's mission is to advance sustainable individual and systems level change that results in improved competitive integrated employment and economic self-sufficiency outcomes for individuals across the spectrum of disability. The center is funded by the Office of Disability Employment Policy at the U.S. Department of Labor. And to provide a welcome to all of you, let me turn next to Christopher Button, the Supervisor, Workforce Systems Policy, Office of Disability Employment Policy, U.S. Department of Labor. Chris?
Thank you, Michael. Thank you all of our LEAD staff, and thank you for all of the folks from across the country who are logging in for this webinar today. We are definitely breaking a record, a registration of 1,300. It's just so awesome to have this kind of interest directed towards this really landmark legislation. It's significant in terms of the opportunity that it creates for people with disabilities who've just been trapped in poverty and afraid to even think about work for fear they might make too much money and lose their benefits. And I think now through ABLE, we have the opportunity for a new discussion. So I, for one, am really looking forward to getting up to date on where the states are with ABLE implementation and to hear from our distinguished panel today, and also, of course, to hear about the great FDIC resources that are going to help people with disabilities move out of financial instability. And we're going to be hearing about those as well. So an information-packed webinar. Welcome to everyone. Thank you for being here. Back to you, Michael.
Thank you, Chris. I do want for everyone who's joining, and people are still coming into the lines, to alert you as well that next week we are going to begin a national dialogue on this topic, the ABLE Act, a tool for financial stability and employment. The dialogue aims to explore multiple ways that ABLE accounts can be used to advance employment and financial self-sufficiency for youth and adults with disabilities. That is going to begin on Monday, May 1st. It is possible already for you to register. You will see on the slide, you register at leadcenter.epolicyworks.org, and I hope you will join us, which will be a continuation, very lively dialogue online as we can share comments, questions, suggestions to really optimize the use of ABLE accounts to help individuals with disabilities, support individuals with disabilities, achieve their employment goals as a pathway to greater economic self-sufficiency. So let me turn next to the presenters and panelists that you're going to hear from today. You're going to first hear from Chris Rodriguez, Director of the ABLE National Resource Center, who's going to go over some ABLE basics. After Chris presents, we're going to hear from me, and I am going to take us from those kind of basic understanding of what's an ABLE account, who's eligible, what can you pay for, and many other, sort of baseline information. I'm going to talk with you about, so how do you use an ABLE account to meet your employment goals and expand the opportunities in terms of employment outcomes and economic self-sufficiency outcomes. I will be followed by Luke Reynolds, who is Chief of Outreach and Program Development at the FDIC. And Luke is joining us because anyone who opens an ABLE account, the account owner is also the account beneficiary, they're going to have a lot of new financial decisions to be made. Creating a budget, deciding on what one is saving for, financial goals. What are we going to distribute funds out of an ABLE account for? What investment options to take and other things. So Luke is going to share with you resources from the FDIC that can help build an individual's financial literacy, knowledge, and skills. We are then going to have a wonderful panel. We have 4 individuals who are going to be joining us. Susan Takow, Chief Executive Officer from the Pennsylvania Assistive Technology Foundation. And Susan is a mom whose son has opened an ABLE account in the state of Pennsylvania. We're going to hear from Matt Shapiro, founder, Six Wheels Consulting Company in Virginia. Matt is ABLE eligible, but has not yet opened an account, but should be opening an account very soon. We're going to hear from Stephanie Hoffer, law professor at Ohio State University, who has opened an ABLE account for her son in the state of Ohio, the Ohio Stable Program. And we're also going to hear from Daniel Elkis, who is a law student at Georgetown University and also a part-time ABLE specialist with the ABLE National Resource Center, and Daniel, too, is ABLE eligible. So lots of folks we're going to hear from, lots of different perspectives. Let's take a look at the agenda. Number one, you're going to hear about ABLE basics. We're then going to turn to the issues around ABLE accounts, promoting financial stability and employment. We then will turn to the FDIC for their presentation on financial literacy materials. And then we're going to go to a Q&A format with our panel, our 4-member panel. And during the whole time, excuse me, you'll have the opportunity to enter your questions in the chat box, and we'll keep watching those, and we will select some of those questions that we can take up during the course of this webinar. So you've got the framework, lots to cover, so glad you've joined us. Let me turn it over to Chris Rodriguez, and he will begin to just, for all of us, level the playing field about ABLE Act and ABLE accounts. Chris?
Great. Thank you so much, Michael. I really appreciate the opportunity to speak with everybody, and I'm extremely excited about the turnout we have today. I think that is a testament to how excited people are out there, both folks with disabilities, providers, family members of people with disabilities, about having this great opportunity that the ABLE Act has allowed. So before we go into the details with Michael about how you can use your ABLE account to benefit employment outcomes, I want to first lay down a foundation so that we all understand the basics around what an ABLE account is and some of the parameters around what the law stipulates. So let's start with the history very quickly. So the ABLE Act, its formal name is the Stephen Beck Jr. Achieving a Better Life Experience Act. And this particular piece of legislation, which took about nearly a decade, 8 years to make its way through the legislative process, was signed into law on December 19th of 2014 after, again, several years of intense advocacy on the national, state, and local levels. By the time this particular piece of legislation made it to the President's desk, it had overwhelming bipartisan support in both the House and the Senate by both Republicans and Democrats alike. And what this law does in its most basic sense is it creates a new option for some people with disabilities and their families to save for the future while protecting eligibility for public benefits such as supplemental security and Medicaid. We're going to get into the subtle nuances behind why I say some people with disabilities and not all people with disabilities here in a little bit, and talk a little bit more specifically about what public benefits that we speak to in terms of those funds being protected. So let's go ahead and get started. So what is an ABLE account? So ABLE accounts are established in a new section called 529A Qualified ABLE Programs. So I don't want folks to be confused if you ever hear the term 529A. That's the exact same thing as somebody saying an ABLE account. So an ABLE account is a 529A account. It's just the more technical name based on where it's specifically found in the law. And ABLE accounts are qualified savings accounts that receive preferred federal tax treatment. And in a little while, we're going to talk about what type of savings account it specifically is and what exactly I mean by preferred federal tax treatment. Additionally, it allows eligible individuals to save for disability-related expenses. Again, we're going to talk about what exactly an eligible individual is and means, and exactly what is a disability-related expense. Basically, what exactly can these funds that are saved in these accounts be used for? It's important to note, and we're very excited to announce that just of this last Monday, the 20th state in the country has launched its ABLE program. So we currently have 20 ABLE programs across the country represented by 20 different states, of which the vast majority of those programs are actually enrolling people nationwide, meaning that provided that you meet the eligibility criteria that we'll discuss in a bit, you can enroll in any one of these programs. You don't necessarily have to enroll in the one in your particular state, so that's very exciting. Also, assets in and distributions for qualified disability expenses will be disregarded or given special treatment in determining eligibility for most federal means-tested benefits. And again, we'll talk about why that is most federal means-tested benefits and not necessarily all, because there is one important caveat to that, and we'll certainly talk about that here in a little bit. Okay, so what are some important requirements of ABLE account? And I want folks to know that regardless, the information that we're getting right now is applicable regardless what particular program you're in. These are founded in the federal law, so no matter if you're in the program that's based out of Ohio, if you're in the program based out of Nebraska, the things that we're discussing right now are going to be consistent across all of those programs. So let's get started. Each eligible individual can only have one ABLE account. So if I'm eligible to open an account and I open it up in Ohio, say, I can't then turn around and go open up an additional account in, say, Nebraska's program. You're only allowed to have one ABLE account at any given time. The designated beneficiary is the account owner. This is something that's very important to note. We wanted to make sure when developing this piece of legislation that is now law that the person with the disability who is the designated beneficiary, who is the account owner, is able to exercise a newfound level of financial independence. We wanted to make sure that they could exercise as much authority over the funds in the ABLE account which belong to them as possible. So the question always arises, well, what happens if the designated beneficiary, the account owner, the person with a disability, again, all the same person, either doesn't have the capacity to have authority or exercise authority of the account, or perhaps they just don't want to? Who else might be able to assist in that? And under the law, currently, there are three types of individuals who can have what's called signature authority. They can set the account up and they can exercise authority over the account on behalf of the person with a disability. And that would have to be the parent of a minor who is qualified to open up an account or who has an account, a guardian of an adult who is eligible to open an account or has an account, or a person that's been granted power of attorney. So if you're not one of those three types of individuals, you cannot have signature authority and exercise authority over the account on behalf of the designated beneficiary. So that's important to know. Again, this goes back to what I just said. There is no federal residency requirement related to establishing an ABLE account. So again, provided that the program that you're interested in is enrolling people nationwide, of which is the vast majority of programs right now, and provided that you meet the eligibility criteria that we'll discuss here in a couple slides, you can enroll in any program regardless of whether you live in that state or not. Additionally, let's say that you open up in one state, but then your state or any other state you think opens and you think you'd be better suited in that state. You do have the option of rolling over your account from one program to another. So don't feel as though just because you enroll in state A that you have to be there, you know, forever. You do have the option of rolling over, and it doesn't have to be a state in which you actually live. Okay. So total annual contributions, so these are the funds that are contributed into a person's ABLE account, do have a limit. And what that is all contributions combined from all contributors are not allowed to exceed $14,000 in any given tax year. So that means from January 1 to December 31st, a person's ABLE account can only accept up to $14,000, and then it will no longer be able to accept any additional contributions until the following tax year, in which you would be able to again start contributing up to that $14,000 in that particular tax year. And again, that's all contributions combined, and anybody can contribute into a person's ABLE account. That includes friends, family, that includes, and this is important for our discussions today, the beneficiary themselves can contribute, perhaps as a result of employment, can contribute funds into their own ABLE account. So that's important to know, but again, all of those combined are not allowed to exceed $14,000 in any given tax year. There's also what's called an aggregate contribution limit, and that's equal to whatever the state in which that person is enrolled in, their ABLE program, whatever their 529 college savings account limit is. And that's typically somewhere between $250,000 all the way up to $550,000. And at that point, what happens is the account will no longer be able to accept contributions until the account balance falls back below that particular cap. It can still continue to accrue interest based on investments and whatnot, but it could not accept any more contributions. And we're not too worried about that right now because obviously we won't see folks hit those numbers for quite some time, considering, again, that we have the $14,000 annual contribution limit from all contributors combined. Okay. So we've discussed a little bit about the basics, the basic components that apply to every ABLE account, and talked about the law a little bit. Now, one of the big questions, obviously, that I want to discuss briefly is who exactly is eligible to open up an ABLE account, and why did I say previously that this is a tax advantage savings account for some people with disabilities, but I didn't say all people? Well, that's because there are eligibility criteria, and some people, unfortunately, with disabilities will not be qualified, but there will be millions of individuals who, in fact, are qualified. And the criteria that needs to be met comes in basically two parts. One is related to the age of onset in which that individual first experienced their disability. And it states that in order to be eligible to open up an ABLE account, the individual must have first experienced their disability before their 26th birthday. So what exactly does that mean? Does that mean that, as an example, I have a brother who lives in Texas, his name is TJ, he's eligible to open up an account. He's currently 34 years old. He's had his disability since birth. Despite the fact that he's over the age of 26, he experienced his disability at birth, which is obviously before age 26, so he would meet that criteria. So it doesn't mean that people above the age of 26 can't meet this criteria. It just means that their disability they had to first experience before their 26th birthday. So let's assume that the individual meets that criteria. There's one other criteria they also have to meet in order to be eligible to open up an account, and that relates to the severity of their disability. So in order to meet the severity criteria, the first requirement, or first of two requirements that need to be made, either or, have to do with whether or not the individual is currently receiving or is currently a beneficiary of SSI or SSDI, basically meaning they meet the criteria with respect to severity that's been established by the Social Security Administration and therefore are receiving those benefits currently. So if the individual, again, meets the age requirement and is a beneficiary of SSI or SSDI, then they, at that point, they can move forward and establish their ABLE account and begin saving for their future. Let's say that the individual does have a severe disability and meets the age criteria, but for whatever reason is not a beneficiary of SSI or SSDI. This could be as a result of them just not applying for it. This could be a result of them perhaps waiting on a determination. This could be a result of an individual who would otherwise meet the severity criteria in Social Security's evaluation, but perhaps they have too many assets, or perhaps they're working. And as a result of their earned income, they do not qualify for it. That individual could still be eligible to open up an account, but they would have to get what's called a disability certification. And what that does is it assures that the individual holds documentation of a physician's diagnosis and signature confirming that the individual meets the functional disability criteria articulated in the ABLE Act. And it's basically the same criteria that Social Security Act uses, but it puts aside the means test and the work requirements and things like that. Okay, moving forward. So we understand some of the basics. We understand exactly who is eligible to open up these accounts. Now the next big question is, what exactly can the funds contributed into an ABLE account pay for? So basically what the law states is that distributions from an ABLE account are to be made for what's called qualified disability expenses. So what are those? Those qualified disability expenses are expenses that relate to the designated beneficiary's blindness or disability and are for the benefit of that designated beneficiary and helps them either increase or maintain his or her health, independence, or quality of life. So as you can imagine, that is a very, very broad definition, and we wanted it that way because we understand and we appreciate the vast diversity in terms of needs of this particular population, and we wanted the law to reflect that as to meet the needs of people with disabilities who are ABLE account owners. To get just a bit more specific, the law states, or the rules and regulations state that qualified disability expenses should be broadly construed, as I just said, and should permit the inclusion of basic living expenses. In addition to that, there is no medical necessity associated for what is a qualified disability-related expense, and it can provide no benefit to others in addition to the benefit of the eligible individual. So when giving people an idea of what types of expenses this could include, Congress wanted to give different categories. I call them buckets of things that could relate to expenses. And as you see on the screen, there are a good variety of different expenses, including education, housing, transportation, employment, training, support, assistive technology, health prevention and wellness, financial management and administrative fees is an interesting one. All the way to funeral and burial expenses, which would be included as a qualified expense as well. And then it kind of has a catch-all, which says any other approved expenses by the Secretary of the Treasury under regulations consistent with the purpose of the program. So it's great that we have a program, and it's great that we have a system that's set up that allows for these private dollars to be used in such an expansive way to meet the needs of people with disabilities. And it's important to note that these funds are meant to supplement, not supplant, federally funded means-tested benefits or supports provided through those programs. It's also important to note that distributions for non-qualified expenditures will be subject to tax consequences and perhaps more importantly may affect the eligibility for federally funded means-tested benefits. So we want to make sure that people understand how to use these accounts responsibly so that they don't accidentally misuse them and perhaps leave vulnerable their eligibility for vital supports and services, perhaps related to things like SSI and Medicaid. Okay. How do ABLE account assets impact eligibility for federal benefits? So ABLE account assets will be disregarded or given favorable treatment when determining eligibility for most federal means-tested benefits. Again, this goes back to the fact that one of the most important and incredible benefits of having an ABLE account that really largely never existed previously is it allows people with disabilities to save for the first time, because often they've been constrained by asset limits related to different benefits that are essential to help them live as independently as possible and exercise self-determination. Therefore, they've had to stay under these limits, really shackling them to a life of poverty. And now, as a result of having an ABLE account, they can in fact save substantial amounts of money in these special accounts without jeopardizing their eligibility for those benefits. Now, it's important to note that there is one exception, and this one exception is why I refer to this as most federal means-tested benefits as opposed to all. And this explicitly is related to folks who are ABLE account owners and also beneficiaries of supplemental security income. So there will be plenty of ABLE account owners who are not on SSI, but for those who are on SSI, they're going to want to pay attention to this provision right here. And what it basically says is that for folks on SSI, once their ABLE account eclipses or exceeds $100,000, the cash benefit related to SSI will be suspended until such time as their account falls back below $100,000. So it's important to note that their eligibility is still intact. It's just the benefit that's associated with being an SSI beneficiary. That monthly cash benefit will be, again, temporarily suspended only until such time as the account falls back below $100,000. So that's important. So folks that are on SSI in a couple years, in a few years, who approach that, they will need to make a decision as to how, if they want to move those funds into perhaps an account that doesn't yield any interest, so it'll sit there, or perhaps make a qualified, pay for a qualified expense or purchase, or perhaps they choose to exceed that and forego that public benefit. So that's a decision they will have to make in accordance with whatever they believe is in their best interest. Additionally, housing expenses are intended to receive the same treatment as all housing costs paid by outside sources. However, there is an exception to this. The new Social Security Administration instructions listed or articulated in the POMS, the Program Operation Manual Systems, says that it will treat housing expenses as resources only if distributed in 1 month and held until the following month. So basically what that means is if you want to spend your ABLE funds on housing expenses, let's say rent, then you need to take them out of the ABLE account in the same month in which you pay for your housing expense or your rent in this particular situation, or they could be counted as in-kind support and maintenance and thus be deducted. You could be subject to a deduction from that monthly cash benefit. Again, when I talk about this kind of exception with the $100,000 related to SSI, everybody always asks, okay, let's say I have over $100,000, does that affect my Medicaid eligibility? The answer is no. SSI, the cash benefit related to being a beneficiary of SSI, is the only means-tested benefit that will be taken into consideration when determining eligibility for these types of benefits. Medicaid will stay intact, as will all others. Lastly, I want to talk about what's called the Medicaid Payback provision, and this is important to take into consideration for all ABLE account owners who are also receiving supports and services through their state Medicaid agency, of which, because of the severity criteria related to the law, a lot of folks who are ABLE account owners will be receiving some type of Medicaid support or service. And what this says is that any assets remaining in an ABLE account when a beneficiary passes away, subject to outstanding qualified disability expenses, including burial and funeral expenses, can be used to reimburse a state for Medicaid payments made on behalf of the beneficiary after the creation of the ABLE account. In this particular circumstance, the state would have to file a claim with the ABLE account program that the deceased individual was enrolled in, and then they would pull the money from there to reimburse the state to the extent there are funds in the account for the Medicaid services provided to the beneficiary, only starting at the time in which they originally opened up the account. So that's an important thing to take into consideration. We often say that this is a great tool for saving funds for an individual's future for the purposes of offsetting disability-related expenses and not jeopardizing your eligibility for federally funded means-tested benefits. But if a big interest of yours is wealth transfer, perhaps this isn't the best tool, and you might want to look elsewhere. Let's see here. Okay. So I think that basically gives folks kind of a really good foundation in understanding the basics around ABLE in terms of characteristics that will be consistent across all programs, who's eligible, what the funds can be used for, how they interact with federally funded means-tested benefits. Now we're going to move on to exactly how can you use your ABLE account to maximize your employment outcomes. But just before I do that, I want everybody to know we're pulling a lot of information from a brief that we're very excited to release, and we're hopeful to get it released out to everybody sometime maybe late next week. So the next part of it is almost like kind of a teaser to this brief, and the brief is on the ABLE Act and employment, maximizing the effectiveness of the Achieving a Better Life Experience Act as a tool for increasing financial stability and employment outcomes for people with disabilities. You can receive it. We'll post it on the website there. You see www.leadcenter.org, or you can receive it through our email list. I encourage everybody to sign up. There's great information not only about this particular topic, but all topics related to employment for people with disabilities that we distribute through that list. So we're very excited about that, but as a kind of a quick teaser or brief summary of some of the things that will be included in that paper, I'm going to turn it to Michael Morris to talk a little bit more about how ABLE can be used as a tool for increasing employment opportunities and overall financial self-sufficiency.
Thank you, Chris, and that was a lot of information to absorb. Hopefully, many of you knew a lot about the basics about ABLE, but let's push forward. Next slide, please. When you think about ABLE and you open an ABLE account, You have a choice, as Chris said, now of 20 different states, all have a basic framework that is established by the federal law. But you want to start thinking about, okay, what kinds of expenses might I cover that would help me achieve my employment goal? Or if employed, might help keep me employed. Or even might help me in thinking about self-employment opportunities. So let's think about what this list looks like. If you look at the next slide, you should understand that although there may be government-funded supports and services for you that may cover job coaching or other types of job development supports, maybe it doesn't cover everything that you'd like. So an ABLE account could be used for job coaching expenses. It could also be used for skill training, costs associated with new certifications, accreditations, or other job-related trainings. It also could be used to help someone prepare a resume for you, or even preparation for an interview that you're going to be getting for hopefully that new job. It also could cover transportation to and from your place of employment, or even you might be in an internship or an apprenticeship. It could cover transportation costs. It also could cover financial planning, financial management services that are helping you think about your financial goals. It could cover benefits planning to set out a course of action for you that, again, would have you consider, wow, you know, exactly how do I look at different government benefits which are not in any way, cannot in any way be adversely impacted by having an ABLE account. What might be some benefits planning that maybe I don't have another source, or maybe I'm told that it will be months till someone will help me. These are all expenses that could be covered under an ABLE account. Next slide, please. So let's look at the way ABLE interacts with some of the major service delivery systems. Let's look first at vocational rehabilitation. Most of you probably on this call know that VR services are authorized under the Rehabilitation Act. Each state has either one or two vocational rehabilitation agencies, either a general one, which covers any potentially eligible people for voc rehab services, but some states also have a separate VR agency for the blind. Well, how does ABLE interact here? VR services can consist of many types of different services, from skills training to paying for a college education, paying for certification. It could be covering, at different times, transportation. It covers lots of things. It can pay for the costs of assistive or rehabilitation technology. But sometimes, even if you're a VR client, you may not be able to get everything that you want. So an ABLE account is not instead of, but could supplement expenses that are being covered by you being a VR client. And since VR is the primary source of public funding for supported employment services and other types of job training services, it may also be a way that you can think more broadly about becoming more skilled. And whether you're working through voc rehab or you're working through some other nonprofit provider who may not be a vendor of services through voc rehab, you have an opportunity to think about an ABLE account. Next slide, please. To think about an ABLE account really supporting your employment goals. VR funds placed in a person's ABLE account, because it could be, can both be used to cover employment services as well as ensuring that a greater number of people with disabilities receive employment supports. It may help reduce the number of people who are on a waiting list or may not being served because of order of selection, where the VR agency has to make choices, has to prioritize who they can serve because they simply don't have enough funding. So there are a variety of ways to think about it, but here's the key. It cannot in any way the fact that you have an ABLE account can't be used in any way against you gaining access for VR services. It can't be used to diminish VR services. Keep that in mind. It's to supplement, not supplant. Next slide, please. Let's take a look at ABLE and Medicaid. Medicaid, for many people with disabilities, also covers lots of long-term services and supports. Medicaid, the Centers for Medicare and Medicaid Services oversees Medicaid buy-in programs that more than 30 states have, designed to support people who are working and retain their support services they need through Medicaid, even though they are now working. The ABLE Act is designed to, again, supplement rather than supplant benefits and services provided through Medicaid. And you may not even know it's Medicaid that's providing the support to you, because you may be getting that support through some type of nonprofit provider agency in your community. It could be an ARC, it could be a UCP, an Easter Seal. Many different types of agencies provide employment support services. But in fact, where that money is coming from is coming through the state Medicaid services, either under a waiver or directly under a state plan. And here again, one key point to remember: this cannot in any way knock you out of eligibility for Medicaid long-term services and supports. It can supplement. It cannot take away anything that you had. It can't suddenly, because now you have an ABLE account, and last year you were getting certain types of even supported employment services with your individual support plan. Now, because you have an ABLE account, no one can tell you, oh, well, you have other resources, we're going to diminish our support for you. The Act was explicit in not allowing that to happen. Next slide, please. So under Medicaid, what are some ABLE-related recommendations? Beneficiaries could consider using ABLE accounts to pay for their Medicaid buy-in program premium. That would be a novel use. Rather than limiting their earned income to stay below Medicaid income limits, so they could continue to be eligible for their Medicaid-funded supported employment or other long-term support services and still steadily improve their financial status. Medicaid case managers could provide assistance in linking people to supports that supports could be about, well, let's help you think about how to open an ABLE account. It could also provide you support in terms of building your financial literacy knowledge and skills, so you make better financial decisions about using funds that are being contributed into your ABLE account. So your individual support plan under a Medicaid home and community-based waiver could add as one of your objectives, I want to open an ABLE account. I want to gain skills in managing that account, because all of that would be ways to enhance your degree of community participation and community inclusion, which would clearly be goals of many of the different types of Medicaid waivers that states apply for and currently receive from the Centers for Medicare and Medicaid Services. People who benefit from Medicaid HCBS can also use ABLE funds as an emergency bridge, waiting for some additional employment services. So there are lots of different ways. The key is to think out of the box, be creative about, wow, now I can save money in an account. I'm not going to lose my benefits, SSI if I'm on it, or Medicaid, or for that matter, other means-tested federal benefits. I really can expand my view of what my quality of life could become. And key to that quality of life for a youth in transition or a working age adult is certainly going to be an employment goal. So ABLE could cover a lot of supports, technology, transportation, benefits planning that's going to make a difference. Let's go on to look at ABLE and SSI. And as we've said, we know Social Security has rules regarding unearned income received by beneficiaries in the SSI program that result in a reduction of monthly cash benefits in the month received. For ABLE account owners, unearned income deposited by family members and others into an ABLE account would be disregarded. Interest, dividends, or an appreciation in value earned in that ABLE account is also disregarded. So what that means is you've got new opportunities here, whether it's from family, friends, or potentially even an employer, to put money into your ABLE account. They need to put it directly into the ABLE account, not give it to you as a gift in terms of income, but it's going to change your opportunities to think about your employment goals and advancing economic self-sufficiency. Next slide. So individuals can place certain resources, including earnings or gifts from family members, into an ABLE account. The SSI beneficiary remains eligible for SSI. Now, here's an interesting concept. Some of you are familiar with PASS plans, Plan for Achieving Self-Support. There are opportunities here to think about how an ABLE account can sit right alongside a PASS plan. And neither has to in any way cause any adverse consequences in terms of your ability to earn. Where you're earning, you're under a PASS plan, money could be going into a PASS plan, and I would say, and it's worth looking at in the future, that part of what you're doing with a PASS plan could be, in terms of advancing self-sufficiency and self-support, is about saving money that's going to go into your ABLE account as well, or help you open an ABLE account. Next slide. So what about ABLE and the workforce system? We know that that the workforce development system under WIOA, Public Law 113-128, places a renewed emphasis on strategies to serve individuals with barriers to employment, including youth and adults with disabilities. Financial assistance is provided to states to help create effective and meaningful participation of youth and adults with disabilities in all types of services and supports, whether they're provided directly at or through American Job Centers and through many other types of one-stop partner agencies and organizations. Next slide. There is, under WIOA, new financial literacy education opportunities. So if a person sees a youth or an adult job seeker who is seeking services under the workforce development system, Title I of WIOA, there may be opportunities here to also think about not just opening an ABLE account, which could be a goal here, but also expanding your knowledge and skills in terms of your financial literacy level. Next slide, please. So what do we think about in terms of the larger workforce development system? What a unique and timely opportunity for state and local workforce development boards to explore partnerships with their state ABLE program. 20 states now have state ABLE programs to improve recruitment of eligible individuals with disabilities and work together on helping individuals set financial goals to improve employment outcomes. American Job Centers can collaborate with a state ABLE program, working even alongside financial institutions to look at ways to offer financial literacy education that includes information about the benefits of an ABLE account to help obtain or retain valued employment options and outcomes. So next slide, please. So where are these new opportunities for collaboration that exist because now we have ABLE programs and the opportunity to open an ABLE account? Well, for the workforce development professional, for the VR counselor, for the community work incentive coordinator who's helping with benefits planning, and the many folks now doing benefits planning, the Medicaid support coordinator, state ABLE program managers, financial institutions, bank and credit union customer representatives, disability employment service, nonprofit providers, and then as well the alternative financing programs, AT loan programs that exist in over 30 states. There is a new opportunity, a new day to think about ABLE accounts as yet another way to help meet program goals. and particularly goals that are going to lead to production of income through work in integrated, competitive employment settings, and then think about other financial goals to advance economic self-sufficiency. Next slide. Where should we be discussing ABLE? Right now and in the next 12 months. We should be talking about it at meetings of state and local workforce development boards. State rehabilitation councils should put this on the agenda of their meetings. State independent living councils, or SILCs, this is not something to ignore. What are we doing to get the word out to eligible individuals with disabilities to think about ABLE accounts which are not adversely going to impact other means-tested government benefits? Many state ABLE programs have formed their own advisory councils that need to reach out and be talking regularly to the disability community. State developmental disability councils that under law are formed by the governor of each state, another opportunity. What are we doing to help education and outreach, and then help with financial literacy and focus on employment goals? And then many states have state employment first planning councils, advisory groups. Every single one of these should not go another 3 months, should not even consider having a meeting without having an ongoing dialogue and conversation. How is ABLE a game changer? How do we get people to understand its benefits, help people open accounts, and begin to set financial goals? And then finally, in terms of, next slide, teachable moments, think about all the individual plans in people's lives. IEPs, individual education plans, individual transition plans, whether it's VR or through the workforce, other parts of the workforce development system, individual plans for employment. Under Medicaid, individual service and support plans, individual benefits plans, individual financial plans, and even thinking about the teachable moment when someone gets a tax return. Could they split part of their return and put some of that money into an ABLE account to begin a pattern of savings? So I covered a lot as fast as I could because we got a lot more to cover, but we'll take more up under questions. I hope you're thinking now, ABLE is the game changer. It's a new tool. Nothing can solve all the challenges and all the barriers facing any individual with a disability in terms of trying to achieve their employment outcome. But this really offers some great new opportunities. So with that, let me turn next to Luke Reynolds, who is the Chief of Outreach and Program Development for FDIC. And the connection here is we all need to be much smarter about money, and Luke is going to tell us about MoneySmart, a tool to foster greater economic inclusion. Luke?
Thank you, Michael. I'm going to briefly run through a few of the FDIC's resources. But first I want to start by overviewing what the FDIC is. The FDIC stands for Federal Deposit Insurance Corporation. We're an independent agency of the U.S. government. Since the FDIC's creation in 1933, no one has lost a penny of money in an FDIC-insured account. In addition to our role as deposit insurance, we also have other responsibilities as well, including making sure that banks we supervise operate in a safe and sound manner, taking complaints from consumers when they don't feel they're treated fairly. We also step in when in the few circumstances where a bank may go out of business, a bank may fail, to make sure all the depositors get their money. What's important to keep in mind is that FDIC insurance covers all deposit accounts, like checking accounts and savings accounts, but it does not cover other financial products or services that banks may offer, perhaps such as stocks or bonds. If you go into a bank and through the bank stores you're being offered a product that's not insured by the FDIC, the bank specifically has to tell you it's not insured by the FDIC. And they'll be taking place in a separate area of the bank. But what's important to know is we insure deposit accounts like checking accounts, savings accounts, and other types of products are not insured, meaning that you may earn more money over many years than you would with a bank account, but then you have the risk of losing some or all of your money. The reason we're here, the FDIC periodically conducts national studies that explore household use of financial services. Most recent studies show that households headed by a working-age individual with a disability, nearly half of these households rely on providers outside the financial mainstream for some or all of their services. In other words, households headed by individuals with a disability are less likely than the general population to have a bank account, meaning a checking account or savings account. They're more likely to use alternative financial services even when they are banked. We have a ladder to visually represent the progressive nature of economic inclusion. The ladder shows the opportunity to foster the development of banking relationships from basic services that promote financial stability to those that enable wealth building and bolster communities. Moving up the ladder, customers gain financial knowledge, resources, and experiences through relationships with an insured depository institution. There are 5 rungs, so to speak, on the ladder. Starts with financial education. Financial education is the foundation. The second rung is insured accounts. Third, credit and savings. Fourth, affordable mortgage. Fifth is small business. Now I'm going to talk about our financial education resources. But first I want to talk about the core financial education principles. The FDIC and the other federal agencies involved with financial education came up with 5 core principles. These are known as the My Money 5. The 5 core principles, the 5 building blocks for managing and growing your money. They are save and invest, protect, borrow, earn, and spend. It's important to keep these principles in mind, both as those who are delivering and developing financial education curriculum of what we should be telling people, and as consumers as we're making day-to-day financial decisions. The FDIC's tools to teach about money are our MoneySmart program. The FDIC has more than 16 years of experience in developing and disseminating quality financial education resources. MoneySmart is available free of charge in several formats. It's available to teach consumers or for consumers to learn online. It's available for different age groups and available in 9 languages. Our main approach is to reach organizations that can use the FDIC's resources to offer training to consumers. Research has shown that our MoneySmart curriculum can be an effective tool to help unbanked individuals develop banking relationships. This slide I'm showing walks through a few of the MoneySmart products, including materials for young people, which include guides for parents and caregivers, materials for adults, materials for older adults, and materials for those considering being an entrepreneur. Just want to draw attention to talk a little bit more about the materials used to teach other people. Then I'm going to talk about the materials consumers can use to learn on their own. So the materials that could be used to teach other people, we call them instructor-led materials. All of our materials are designed to be picked up and taught right away without any preparation because they have detailed guides to help people know what to teach, what to say when to put up a slide, and so on. The materials, so our MoneySmart for Adults curriculum, for example, there are 11 modules in the curriculum, but you can just pick a topic. Like, let's say you just want to talk about savings accounts, or let's just say you want to talk about creating the spending plan so people can figure some ways to put money in a savings account. You can just pick that module and teach it. We have large print and Braille versions of MoneySmart. We also have crosswalks. So Michael talked a little earlier about employment programs. We have crosswalks between MoneySmart and the Workforce Innovation Opportunity Act. Certain sections of the Workforce Innovation Opportunity Act require financial education to be provided, particularly to young people participating in federally funded youth employment programs. So we have crosswalks to help show what parts of MoneySmart can be used to satisfy the financial education requirements in the Workforce Innovation Opportunity Act. I also want to mention that we're currently completely revamping and updating our MoneySmart for Adults product. We're using the principle of universal design. We want to make sure it is as useful and relevant as possible for all segments of the community who use it, including when it's being used for persons with disabilities. We want to make sure, for example, it's talking about the full range of financial products that have relevance. We're in the process of developing that curriculum now, and then we would expect it to be available to download in 2018 or sometime early next year, probably first quarter of next year. We may have some pieces, updated pieces here and there ready for use this year. We also have self-paced resources. These are materials that people can use to learn on their own, but they also can be used in conjunction with instructor-led training. For example, one of our most popular self-paced products is our CBI, our computer-based instruction. It has the structure of a game. So you go in, if there are two tracks, there's an adult and young adult track. That's assuming you're going on the adult track. You can go through the adult track, go through and learn the key points of the 11 modules, and then you can get certificates of completion for going through each of the modules. Some programs we know require people to go through the CBI and produce their certificates of completion. Then we have podcast version of MoneySmart as well. In addition to providing the curriculum, we also provide some ideas and strategies on how it can be used. Key to do this is MoneySmart News. This is our periodic online newsletter which highlights updates on the MoneySmart program, updates on financial education more broadly, and then gives success stories. So these are case studies of how the MoneySmart program is being used. We really welcome people to share with us how they're using MoneySmart and some of the tips they've learned, some of the tactics they're using, because some of these we publish in MoneySmart News to help others. So you'll see, for example, we have a success story on best practices for teaching people with visual impairments. We have one on employment, integrating MoneySmart into employment programs. We have a network of, so MoneySmart is free to download from the FDIC at fdic.gov/education, FDIC/education. It's free to order, to download, and begin using MoneySmart. You don't have to get approval from us. You don't have to go through training from us. But we do encourage people who are using MoneySmart to join our MoneySmart Alliance. It's free to sign up. It's simple to sign up. In exchange for you agreeing to, or if you're using MoneySmart, if you're teaching the curriculum, you're promoting it, you can sign up for the Alliance, and then you'll get a point of contact from the FDIC you can reach out to if you have questions. You'll be listed online in our online directory of members, and if you have a success story you want to publish in MoneySmart News, you'll receive priority consideration. You can learn more about MoneySmart Alliance on the website I mentioned, fdic.gov/education. So what we do, we provide the curriculum, we provide technical assistance to those who are using the curriculum. We periodically publish how the curriculum is being used, but we also want to hear questions people may have on the MoneySmart program. We often get asked, what are some of the best ways to teach financial education? The Government Accountability Office has concluded that there's no single approach that's best practice, but there's some consensus on key common elements for successful programs. Those are on the slide, including timely and relevant content, accessibility, meaning programs being accessible to the communities they're intending to serve. I don't have time to go through them all in detail. I want to leave you with the fact that we have staff around the country, community affairs staff around the country, who are resources for banks and nonprofits and others who are working on economic inclusion initiatives. So for example, if you want to connect MoneySmart to an effort to help promote savings, reach out to FDIC. Maybe we can be of assistance. You'll see us on the slide, our regions. The last slide is the email I mentioned. If you have any questions based on what I talked about, feel free to reach out to us. I think I'm out of time. Thank you for your time and attention this afternoon.
Thank you so much, Luke, and terrific resource, and I hope more people will access the Community Affairs regional offices and MoneySmart. So let's go to our last section, and we've got 4 members of a panel, and let me jump right in, and let me go first to Stephanie in Ohio. Stephanie, why did you choose to open an ABLE account for your son?
Well, Michael, my son George is 6, and looking into the future, as parents, we were concerned about his ability just to cover everyday expenses. Ohio has a limit on savings of roughly $2,000 for individuals that want to remain eligible for Medicaid. And because we don't know what his capability will be. He might work at a full-time job with medical insurance, or he might not. We wanted to put away some money for the future so that he would be able to cover those expenses that aren't going to be picked up by state programs, and we want him to be able to protect his eligibility for those services that he'll need to remain independent in the community. Okay, thanks, Stephanie. And let me go next to Susan. Your son, Michael, I think was the second person to open an ABLE account in Pennsylvania. How does an ABLE account perhaps tie into when you think about employment goals?
Well, I actually asked Michael what he thought about this question, and he's delighted to be having an ABLE account for a couple of reasons. One, he can control the funds himself, and he can then save. And he's very interested in perhaps going and getting more education. And so those funds can help him save for the tuition and all of the fees. He also is a client, a customer of Vocational Rehabilitation. And the problem, as many people have experienced, is that it's just a little slow sometimes to get what he needs. So we just got a new computer, and he's now researching a new table that will go up and down and get so his wheelchair can fit underneath. So that's the 2 answers he gave us, is more education and some of the assistive technology that he wants to get.
And Daniel, who's sitting with me here. Daniel, you're a student at Georgetown University Law School. You're ABLE eligible. What do you think about in terms of how an ABLE account might help you with your future employment goals?
So an ABLE account will be very helpful for my future employment goals because it will help to pay for transportation expenses, and it'll help to pay for transportation expenses and for a therapeutic diet, which will allow me to be very successful in the employment sphere, as well as potentially for a down payment on a condominium as I begin my career.
Okay, and Matt, if you're there, I think you have not yet opened an ABLE account in Virginia, but when you think about your employment goals, you've started your own consulting firm, you're your own entrepreneur. How will an ABLE account help you with your employment goals?
Sure. So first off, thank you, Michael. I am an account holder in Virginia, and one of the biggest things that I think it will allow me to do is take the earnings or some of the earnings that I make when I'm doing my consulting business and be able to save that money effectively in my ABLE account after I do, a job or something within my consulting business without having the fear of losing my benefits or having that affected in any way. So that's a very exciting possibility for me that I will definitely be taking advantage of.
So I'm going to go to the next question, which is why do there's so many things to take into consideration, so many states now with ABLE programs. maybe I'll go to Susan first. Pennsylvania is a brand new program. What did you take into consideration when you chose the Pennsylvania ABLE program over others?
Two things. One is, and the most important thing is that our state legislation has a prevention of the clawback provision. So like what, Chris talked about a little while ago, there's the Medicaid Payback. Our state, in its legislation, said it will not file a claim. That is different, however, than the estate recovery, which occurs at age 55 and older, but we're going to deal with that. But the fact that when Michael dies, what remains in his account will then go into his estate was critically important. Also, the fees are pretty low, and the website was really easy for Michael to understand and kind of sign up, including looking at the investment strategies. He could understand the way it was kind of laid out. And some of the other states, it was a little more complicated.
Okay. And Stephanie, I know, as you said, you've got a young son, but already thinking ahead to many years in the future when you hope he might be employed and independent. What made you choose Ohio's program?
Well, to be honest, I worked with the Ohio Treasurer's Office to help set this program up. Not closely, but they were great. So they consulted not only me, but many other parents of individuals with disabilities and many individuals in the community who are working with disabilities and lots of advocacy groups. I feel like the program that resulted is a really strong program. So some features that I like about it are it has a debit card that you can use with no charge. I think people who are looking at programs are going to want to consider what the state reporting requirements are. Ohio is not asking us really for very much, and so that's great. The 529 cap here in Ohio, which dictates, as Chris mentioned earlier, how much we can contribute to the account overall is really quite high. So we wanted to be able to build up a large amount of savings for George, and Ohio, the Ohio program allows that to happen. The transaction fees are low. And in addition, Ohio has a really nice record-keeping tool if you're using the debit card. It has a nice online record-keeping tool. So if you're keeping track of expenses for the Social Security Administration or for the IRS, that resource is there and available. So those are just some of the things I think that make it a strong program.
Okay. And Stephanie, you mentioned several things, and I'm going to go to some of the questions, and we have a lot of questions in the chat box, so let me try to take a few. One is a question asked, do states currently that offer ABLE programs have debit cards? And as Stephanie just mentioned, Ohio does. You'll need to look carefully. Not every state does. Some states have them, but have a lot of fees attached to them. Some states have no fees. So this is some of the comparison. And I urge you to take a look at, it's really the only website that allows you to compare multiple state programs across different critical elements, and that's ABLE NRC, ABLE National Resource Center, ablenrc.org, where you can learn a lot more about ABLE programs and can be linked to any of the state programs that are currently open. Another question we got is, can married couples on SSI open individual ABLE accounts? And the answer to that is yes. They can open two separate accounts. No one is allowed to have more than one account, but a married couple, both of whom might be eligible because they're both on SSI, and if the age of onset of disability was before age 26, they could open two accounts, one for each one of them. So wanted to clear that up. Another question came in and asked about when will staff in SSA's, Social Security Administration's regional offices be trained? And there are a few comments about this. I do not have a direct answer, but we do talk regularly with SSA. Hopefully they are going to roll out some internal training so that people are getting consistent answers to questions when they inquire nationwide, but we will try to learn more, and it is something we are pushing across federal agencies to work together to have consistent answers, making sure that no one is harmed as the law intended in terms of someone opening an ABLE account. This is supplement to any government benefit you already are receiving, except for the few individual circumstances that Chris went over. Another question that came up is can an individual have an ABLE account and a special needs trust? And the answer to that is absolutely. There is no reason you can't have at the same time a Social Security pass plan that we talked about briefly, an ABLE account, and a special needs trust. There are different reasons one might have a special needs trust and an ABLE account, but one of those is what Susan mentioned regarding her son Michael, in that the account beneficiary is the account owner, and it's an opportunity for someone to build their own financial skills, be more self-directed and self-determined in their lives. So yes, one could have a special needs trust. There are also the differences, and I want Chris to just go over the point again related to housing as well as basic maintenance costs, because this is one of the big exceptions versus special needs trust.
Thank you, Michael. So, and a lot of considerations and a lot of circumstances when you are a beneficiary of what's called Supplemental Security Income, or SSI, and somebody else provides you with what's called in-kind support or maintenance. This means either financial assistance or allows you certain types of benefits that contribute to your basic living needs. This could be, you know, if a parent pays for somebody's rent or gives somebody a free place to stay that's a beneficiary of SSI, then Social Security can go in observation of this and lower that individual's cash benefit, the monthly cash benefit, because they consider it another person providing that for you, so then they deduct up to 1/3 of your SSI benefit. The way that ABLE works is because the money is considered the person's money, it's their money, despite the fact that it could have been contributed from others, as long as you pay for that living expense, in this circumstance rent, in the same month that you pull the money out of the ABLE account, it will not be counted as in-kind support and maintenance, and thus will not deduct from your SSI cash monthly benefit.
Go to a few other questions that have come in the chat box. One question was, is an ABLE account difficult to set up? Where do I go? What do I do? And the answer to that is that, again, if you're looking for every link to any state that has opened an ABLE program, the easiest way to find all those links is go to ablenrc.org, because there's a map of the United States. You can touch any state on the map, and it will take you exactly to the link about opening an account. I have heard for some people who have gone online, every ABLE account, every state program that's open, you can open it online. You don't have to go anywhere to meet with anyone. You do not need an attorney. The cost of opening an account in just about every state is minimal. There was 1 or 2 states that had a cost less than $10 to open an account. Some for a while were free just to get people to open an account. But you'll want to pay attention to what are the monthly maintenance or administrative fees. Someone asked, well, is it as complicated as, do I need an attorney? Is there a lot of paperwork? Is this going to take hours? And the answer is no, it should not. But you want to be an informed consumer. You do want to learn and compare some of those critical elements about what are the investment choices. Can I put money into a savings account and be assured that none of the money, none of the contributions made to my account then are ever going to be lost? Yes. Is it possible, question came in, can you lose money that you put into an ABLE account? That depends on the choice you make as to where that money is going to be saved or invested. Every state ABLE program is offering a series of choices. Some have no risk, like a savings account, but there won't be that much growth. Others offer different degrees of risk where there's a lot of opportunity for growth, but there's also greater risk of that money from the principal, money that you've contributed to the account may be lost. So those are some challenges, but you want to become an educated, informed consumer. We have a few questions from people in individual states who have asked, how can I get someone to come to my program, talk with my VR agency, talk with my counselor about ABLE programs? And here again, if you contact the link on the ABLE National Resource Center, ablenrc.org map, you're going to get to talk to someone in your state, if your state is open, or it could be, as many states are marketing nationwide, because you do not have to live in the state of the program. You can probably learn whether they do have people who will either do a webinar online or will set up a conference call with you. Every state who has opened an ABLE program has a call center, so you can call them, ask questions, try to learn more, and I would urge you to do that as well. Someone asked, does every state offer the option for out-of-state individuals to participate in their program? There are 2 exceptions. Right now, that may change. There are 3. One exception in Florida, you must be a Florida resident. In Kentucky, you must be a Kentucky resident. And Chris, there's a 3rd?
Missouri, I believe, just launched, and they have an in-state program. But like I said previously, the vast majority of programs that are currently available are available nationwide. There's, again, 20 states have launched, and we expect probably to see well over half the states in the country having launched by the end of this year. And to keep up to date with which states have launched, I encourage folks, again, to go to the ABLE National Resource Center website and sign up for our listserv so you get all our ABLE alerts and can get the most up-to-date information related to ABLE.
There are some questions about what would be a non-qualified disability expense, and of course then not be able to use money coming out of an account tax-free. And there are a number of questions here in the chat box about how about going on vacation? How about going to a baseball game? Could that be a qualified disability expense? Well, the real answer to this is how you frame what you're using the money for. I would suggest probably simply to go to a baseball game with no explanation that that might be about learning independent living skills, might be even learning money management because you're purchasing a ticket, you're going to keep a budget, or you were saving over time. It has to relate to some skills development, growing more independent, you're improving your health, being more productive from a work standpoint. Here's the interesting thing. There is a tax form that will, it started this year for expenses in 2016, where you are not going to have to provide a lot of documentation. You're basically certifying that you use the money for a qualified disability expense. Some people randomly are going to be selected by the IRS and will be needing to provide more documentation. But so you want to think in terms of skill development, being more productive. There's a question about self-employment. Could I buy a computer? Could I buy materials I need because I want to start my own business? Absolutely. Self-employment qualifies. And so that's a reason to save in terms of an ABLE account. Another person asks and says, I live in a rural area. Could a taxi to get to a job I know about in town, even though that's expensive, if I save money in my ABLE account, could it cover the expense of transportation to and from work? Absolutely. That would be covered. What wouldn't be covered is, of course, and it's usually the vices. In other words, money to purchase alcohol wouldn't be covered. Money for gambling or gambling debts wouldn't be covered. But again, think about things in terms of maximizing independence, productivity, and better health and welfare. Let me go back to the panel for a moment, and I'm going to ask Matt. Matt, you're a few years out of college. You opened an ABLE account in Virginia. How do you see long-term, staying with this employment focus on this webinar, how do you see your ABLE account supporting your business? You started a business to be a speaker in front of groups, be a kind of motivational speaker. How's an ABLE account going to work for you in that way?
So I know I said a little bit earlier, but I think the first thing that it will allow me to do is finally be able to save, which I hadn't been able to do, and I was always nervous about, you know, losing out on benefits that I might receive. I can also, you know, hopefully, you know, use some of the expenses that I might keep in my ABLE account to do things to help improve my business, to make it better, so that I can continue to grow as a business owner, continue to get clients and speaking opportunities, and just help make sure that I'm successful today and into the future. So, you know, it's just another tool to make sure that I and anyone else who has a disability and particularly wants to start a business could have some monetary benefits and tools to be able to use throughout that process.
Okay. And Daniel, you're in law school. Whether you work in the future as a lawyer or I know you have an interest in policy related to advancing the independence of people with disabilities. Can you think of some expenses that are employment related? Are there technology expenses or other things that might help you be more independent and use an ABLE account?
Dragon dictation would be very helpful. It's a software that allows me to turn my voice into text when creating documents. The ability to travel to conferences, both on the legal and the policy side, continuing legal education, and preparation for the state bar exams are some of the expenses in the near future that I see helping me reach my employment goals that I could use an ABLE account for.
Thank you. And Susan, I don't know if you may have asked that question of Michael, but perhaps your son, as he looks ahead in terms of employment, are there ABLE account expenses you foresee in the future? You talked about some already in terms of computer purchase and some furniture, stand-up desk or something. Are there others that you think about?
I don't think so. I think what Michael's really excited about is it's a safe way to save. Because he lives in his own house and with two others of his friends, there are a lot of people coming and going in his house. So historically, he's kept cash around, and that cash disappears. So I think this is kind of the first time he's ever begun to plan and feel safe about being able to plan for his future.
Okay. They're telling me I am out of time. I want to quickly move the slides to just leave up resources, theablenrc.org, and some key parts. The state comparison tool that exists on that site, I think, is pretty important. Let me say to so many of you, because we have over 50 questions that came in the chat box, we will look at each one, and then we will post answers on the Lead Center website. Some may require us going to federal agencies to get clarification, but we will try to respond again to all those questions. We do have a national dialogue on ABLE that will begin, as I said, on Monday. Here's where this conversation can continue. So I hope you will look at joining us there as well. Covered a lot of ground. We've answered a lot of questions. There are many more, but just keep in mind, ABLE is a down payment on freedom. It's a contribution to an account that can change quality of life, employment outcomes, as well as advance self-sufficiency. For someone who may have a special needs trust, there are reasons to still do an ABLE account. For someone who is not on SSI, not on government benefits, it's an opportunity to grow resources tax-free, which really means making more use of money that you might have rather than putting it in your own savings account. And so there's lots of ways to think about this, and if you're on the provider side or on the policymaker side, whether you're a workforce development board, a state independent living council, a state rehabilitation council, DD council, this should be on the agenda. This should be talked about at every meeting. What are we doing in helping people understand this as a new option and tool? Let me finally turn it over to Chris Button for a final few words.
Thank you so much, Michael. Thank you to our guest panelists, Susan, Matthew, Stephanie, Daniel, and to Luke from FDIC. I learned so much. I can't wait to talk with lead staff about what we can do next as we continue to try to have people appreciate the value of ABLE accounts. Michael, I loved your down payment on freedom analogy. I actually recall looking up the definition of freedom a couple of years ago, and one of the little subparts said having all the benefits of membership or citizenship. And ABLE accounts can certainly help get us there. Thank you to everyone for being here today.
All right, we'll sign off there. Do look at ablenrc.org, and we will post. Give us a week to 10 days. We will try to answer every single question that was posted in the chat box, and hope that you will look at leadcenter.org for those answers. Join us in the conversation online that begins Monday. All of this information, the slides, will be posted and archived on the Lead Center website, leadcenter.org. Thank you so much, and please think about spreading the word about ABLE, because it truly is a tool to promote employment outcomes and advance economic self-sufficiency. Thank you so much. Talk to you soon. Bye-bye.